Gonna make the world a better place. Gonna make the world a better place. Gonna make the world a better place. Gonna make it home.
I brought in the beef jerky and I ate it before we started filming because I didn't want to embarrass
goodness.
myself and you on camera. I already had a hot flash, which was crazy last time. Damn, dude. Now I have a vest and a sweater on. Let's see how this goes. This might be a complete nightmare, but
I think it was triggered by something last time. I don't remember.
it's called age.
Stop it.
We're getting old, man. Someone was like, oh, after 42, it's downhill. I'm like, dang,
Yeah,
is
I
that?
know.
I mean, that's kind of crushing. Anyways,
But
y'all,
it's feel it.
you do definitely feel in your body. What's going on? I'm Dr. Jeremy Cross.
And I'm Dr. Allie Cross.
And this is Footprints to Blueprints. They didn't hear me swallow when I did that. I promise you. What's
I
goody?
did.
You? Yeah, I know you always do. Here's my thing. I have a couple questions
This is what it
for you.
sounds like. Did you hear it?
That's called a natural swallow, by the way.
Anyway, okay, what?
All right, couple questions, okay? I want to ask you a few questions, just some foot myths.
Okay.
So, do you think a person's shoe size is directly correlated with other parts of their body? I feel like that's a fair question.
I don't know. Is my face red?
Your face is red right now.
Um,
Dr. Allen,
I don't know.
In your
because
experience.
I know. Jeez. I don't know. I don't know.
So you're
Do you? Maybe you're a better person to talk about that, Mr. I was in locker rooms forever. Not that you
I don't
saw it.
I don't know if I mean, I'm sure there may be some correlation.
Came from somewhere.
It came from, I think there's a truth to every myth.
Little man syndrome is pretty legit, and I should probably look at their feet more.
Yeah.
Usually it's short.
I mean,
but I don't
I've
look at
only
their
dated
feet.
women, so I didn't look at a woman's foot and go like, oh, does her foot correlate to her breast size or her butt size? There's never been that
That's
correlation.
not the correlation. The
I know that.
correlation
I'm
is
just
to
saying.
a man.
Is there a correlation between someone's foot size and their body parts? And
I
you're
don't
going with a
know.
you don't know. I think that's BS. I think you have an answer.
I'm not gonna answer
All
that.
right. Well, it's a question for the audience. Do you
Yeah,
feel
yeah.
that
For the
someone's
audience, not for
shoe
me.
size is directly correlated with?
I would prefer not to think about that. I
Other
look at
parts of
feet
bodies.
all day long.
I got to be honest though. I have to be honest though. If I see someone's feet and they're not taking care of their feet, I definitely think there's no way you're washing your ass and your other private
No,
parts.
I know you feel that way. I agree.
That's how I feel. I'm like, if your feet smell like this, your vagina definitely
Ew,
smells.
Your booty do
It's
too.
just- I feel that way, but I mean, it's not me judging
true.
people. It's just like I get some people can't reach down there and actually wash.
Which
wash
makes
their
it
feet, but
sad, but
It is, but we've got to.
oh god.
You got to take care of your feet. All right, I got another one for you. So
What?
it's not a question, but I want to just play this reel for you and see how you would feel if my feet look like this and I put them up against you. Give me a second to pull it up here. I just want to know.
I mean, your feet are nice, and there's times where I don't like your feet touching my feet.
But if your feet look like this, or my feet look like this, how would you feel?
I
with
mean,
me trying to put him up.
definitely seen worse feet.
I mean,
But there's what is wrong with his toe?
he's got some fungus going on there. I think this guy is a runner. He's missing a toenail kind of on the second.
I don't know.
Are you afraid of
Feet?
other people's feet besides your patients? Like,
No, I don't have a foot phobia. Some people really do have foot phobias. I had a sorority sister who was legit had a foot phobia.
just couldn't.
No. And
Okay,
people
feet.
would joke around with her and like try to touch her with their feet and stuff. No, she no.
What do you think it is? I mean, for me, I would have more of a phobia of looking in someone's mouth rather than their feet. Like, people are all the time like, well, why feet? And I'm like, bro, I would much rather look at someone's foot than be inside their mouth.
Depending on the patient, like I get nervous about what their feet are going to look like and the smell. Like I had some pretty bad smelling feet this week.
Yeah.
And that's really awful. Like that smell is really awful. It's hard to get out of your nose. And mouths, I think a lot of people have bad breath.
Yeah, a lot of people have
Like-
halitosis where it's like,
And so the reality is dental work is usually when you need it. Maybe. I don't know. Maybe not. I don't know. We should ask Alfonso.
we should call my
would be
brother-in-law.
fun to call. Yeah, he would be hysterical.
I wonder if he would answer right now if I called him.
What day is it?
I'm calling him. He might be
It's Wednesday. He's not trying. He shouldn't be traveling.
he might be in surgery. I'm calling my
him, see.
brother-in-law.
See, he's a prosthodontist for Clear Choice, so
Let's see if
maybe
he
we'll see.
answers.
He might be in the middle of clinic.
Should I FaceTime him or just call? Let's see.
I don't know. Let's see if he answers. I don't know.
We're calling him.
There's other
It's
body
ringing.
parts. People say white feet, and I'm like, well, there's other areas.
Definitely other areas.
I've been having my carpal tunnel. Do you know where my brace is?
Couldn't find your brace.
Dang.
Oh, man. Unacceptable.
Shoot. Maybe we'll try again.
It's completely unacceptable that you didn't answer. I just called you while we were on the podcast because I had a question related to dentistry. Call me back. Love that guy. Anyways, but once again, so my thing too is like mouth smells though. I feel like if you can't take care of, I'm a smell person. If you
You're
can't take care of your,
OCD germ person, though. I mean, I don't think about this stuff long enough.
I do.
I
mean,
got
you're
other
too
stuff
close.
to think about, not hypothetical, disgusting situations.
Yeah, I mean, you're busy lady doing a lot of things. All right. Another question.
Okay.
Another question on board.
Dun, dun, dun.
All right. If you were a type of shoe, what would you be?
That's a hard one.
It can be seasonal. Let's just say summer.
That's hard because I don't really like flip-flops anymore. I have been digging my Birkenstocks.
Yeah.
I feel like they're comfortable. They're good support. There's different types. They get better with age.
I can dig that. I would be a Tiva
Yeah. Mine are squeaky
sandal or a
right
Birkenstock.
now. Aqua socks. Jellies. There's some
Okay.
good shoes.
What about for the fall?
Something sturdy and hardy. Probably my Docs. I mean, they're sure the shoes that I currently own. They're waterproof, that they don't get wet.
I rock with my Doc Martens really tough during the fall
They gave me a
seasons.
callus though. So this is what I talked about with my patients is that they come in with all these new calluses everywhere on their feet. They've never had it. Why now? And I wore my Doc boots last year a lot, quite a bit. And I got calluses formation on my fifth toes. That hurt like the dickens.
But to be honest, you have bunions. So your
Excuse
feet,
me.
I'm just saying. I'm not trying to put your feet on blast, but your feet are a little
I
bit
have
wider
Taylor's
than most
bunions.
people.
Hey,
So you have bunions and Taylor's bunions, which is going to put you in a situation where you're likely going to have
it's not
rubbing in your
even
shoe.
because of that. It's because of my baby toes are. It's maybe because my Taylor's bunions are causing them to
Does your
turn.
baby toe
Let's
curl
not
in?
talk about baby toes, Mister.
My baby toe is non-functional, and I'm okay with that.
Yeah.
I don't know. It's like the baby toenail.
It doesn't even look like it's attached to your
I
foot
think
properly.
most people's baby toenail it should be non-existent because it
Well,
really is very.
that's a conversation that we have a lot with people is because that toenail is usually thicker than all the other toenails because of the pressure from the shoe gear.
Yeah.
It's not usually fungus, and everyone thinks it's fungus.
Okay. Wintertime. What are you rocking?
Not Docs.
What type of shoe are you in the winter?
I don't know. I don't really like the big snowy boots.
I'm a Timberland guy. I love
probably
wearing
still
some
wear my
Tim's or
Docs.
Clarks for me.
I don't really. Why would I? I
You
don't
have
know.
boots though. You have like
I have my Sorels.
your Sorels, which I think are nice.
Just a warmer shoe, I guess. I don't know. Comfortable. All I want is to be comfortable.
Yeah. Okay. Springtime.
I don't know. That's a hard one because you still need it to be like waterproof. What do I wear in the spring? I start wearing sandals pretty early because I'm so tired of wearing my boots.
All right.
I don't know.
Here's my thing. Podiatry pickup lines.
Oh Lord.
What's the
These are
funniest?
like dad jokes.
No, I mean, here is
Pickup lines. Like what have people
Podiatry.
said to me?
yeah.
Well, yesterday or last Friday, I had a patient at the VA go, my first pedicure was in Europe. Where was it? Pakistan or something like that. It was like Europe somewhere. And I was like, oh, well, how was it? I don't know, just trying to make conversation. He goes, well, my dick didn't fall off.
What? What did that have to do with the pedicure? Oh, a happy ending.
Yeah, I don't know. And I was like,
wow.
I like made a noise. I was not expecting for him to say it. And you were in the other room. This was at the VA. And I was so caught off guard. And I was like, okay. Like, I didn't even know what to say. And he was like, well, it ended well. I don't know. I can't even remember what he said. But I was just like, that was so inappropriate.
It ended well? Super inappropriate. That is crazy.
Like vulgar like that. Not like, I mean, I don't even know I was so thrown off. I was like, how inappropriate for him to have said that to me as I'm touching his feet. Like, talk about weird fetishes, whatever. I don't know what it was, but I was like, oh, Lord.
I think it's really strange when patients make sexual comments and you're down there on their feet. It is like, it's weird. And people do. I feel like some people are like, I'm super sensitive about my feet. And then like they expose their feet and you start touching their feet and you're having conversation. And I don't know what it is about touching someone's feet, but they just start opening it up and telling you all the tea. You're like, wow, what's going on? I'm sure that happens in other professions, but I mean, unless you're like in urology or...
I just thought it was really inappropriate.
Do they make sexual preferences and stuff like that? That's crazy.
Yeah.
Super inappropriate.
You've had some pretty interesting encounters too.
The pickup line that I recently heard was, oh, so, are you a podiatrist? And I said, well, yeah. She's like, yeah, because I'm head over heels for you.
Stop it. No one said that to you.
Yes.
No.
I'm dead serious. I was like, that's hilarious.
Who?
Last week.
Stop it.
70-year-old woman.
No.
Came in
You're
like
lying.
a cougar.
You're lying.
I'm telling you, don't leave me in those rooms with those women.
Come on.
I'm being dead serious.
Are you serious?
Yeah, I think she was just trying to be
Ew.
lighthearted and open it up, but
Lord.
I thought it was funny. I mean, what else are you supposed to do in those situations except for smile? I just kill people with smiles all day. Like, if it's awkward, hit them with a smile, right?
That's why you loved the masks, because your face would be covered.
But I still feel like your eyes say it all.
I know it does. That's why I'm like, well, the mask didn't do anything for me, because you can see it all over my eyes.
Yeah, that totally happens. But do you think female podiatrists get hit on more than, or just female doctors or providers get hit on more than male providers?
That's an interesting topic, because I think as a female provider, we get hit on maybe, but I feel like you get a lot more inappropriate comments. Like, I feel like there's a big nuance with that. Like, I feel like people don't realize this is a whole like sexual harassment, that everyone thinks it's just women who have these cases. Yeah. And it's actually, you get hit on and inappropriate things said to you all the time.
Yeah.
And I think it's both. And I think a lot of it's not talked about it as often, maybe just because men don't care as much. But I feel like it can affect. It makes you still feel uncomfortable. I mean, I don't know, but I think men go through it a lot more than it's talked about.
I agree.
And it puts you in a dangerous situation, just like it puts me. And then the hard part is, if you were to say something, the reaction of the female patient who said it would then turn quickly to be like,
yeah.
And it's really hard. I mean, it's like crying wolf, right? You're like, okay, this was inappropriate. You call them out on it, and then they essentially turn it around on you like you were the one who was inappropriate.
No,
and
I agree.
It's hard because it's not okay. And as a woman, we get a lot of other slack of like not being good enough or strong enough or like all of that stuff. But I think harassment towards men as providers happen probably the same amount. I mean, I don't know. I mean, it'd be good to kind of keep track of, but
I think no matter what, I think that some patients just get too comfortable and they feel that they can say anything. Like I was seeing a patient and we were discussing them having elevated labs, and I told him sometimes labs can just be elevated, right? And I said I've had labs that were elevated at times, and it was like, wow, I mean, nothing's changed. I don't understand why that's elevated. And the gentleman was like, well, labs can be elevated in the African American culture. And he's like, did I say that right? And I was like, I mean, yeah, I mean, you said it fine. I mean, African American and it was like, or black, whatever, however you want to preference that. You know what I mean? He's like, well, I could have called you the other word.
Yeah. Like,
I'm
why?
like,
Well,
no, like legit, I'm sitting here. Guess what I hit him with, guys? A smile. But how in that space are you supposed to respond? Like, there legit are times where you're so thrown off because you're like, I can't even believe that this person said that. Like, imagine if I said some shit like that. Like, how crazy the response would be. You know what I mean? So, and it's always one of those things where you're driving home and you're kind of just reflecting. You're like, I can't even believe that.
Well, because in that moment, you are so shocked that it's being said. Like, the follow-up comment to him saying that, though, was what? I can say that because I have.
Oh, he was like, I can say that because I have a black daughter. And I was like,
that's like saying, I can do that because I have a black friend. Like, then it turns you into the token. And that's just, it's so frustrating because we have black children and I would never even say that or joke around. Like, why would you even, to me, I don't know, maybe they think it's cool. Like, the processing of people's brains are so shocking to me. And we are interacting with so many people on a daily basis. Like, the human personality is really weird.
Yeah.
Like, psychology is a great profession because of how interestingly weird people are.
I agree with that.
I mean, and we're spunky people. Like, we know we have our quirks and stuff, but it's just strange.
Listen, I'm weird, but I mean, I own that. There's a
But
difference
you're not
between
inappropriate.
That's what I was gonna
and
say.
you're
There's a difference
not,
between being
like,
weird and inappropriate. You can be weird and like fun. There's people that have like
there's
that
like
weird
the social
quirky
cues,
personality.
and you're like, yeah, you shouldn't have said that to me.
Yeah, but I'm hyper aware of those things, and I just think that some people have never been put in situations where they've been called out. And like you said, if I were then to call out that patient, then what? Now all of a sudden, I'm confrontational, right? So I always have to be prepared for that curveball of like, well, you made it a bigger deal than it needed to be.
It's still a way of control, right? Because they're in your place of work. But if you were to say something like that to them or a response to that comment, you should have been like what? And then said it and then see what you would have said. And then what? And then if you would have said that, though, then you would have been, quote unquote, aggressive.
Yeah, I just think only negativity comes from that. And so I have to, in my position,
ignore it. That's what they want.
Yeah.
Ignoring, brushing it under the rug.
But what happens with that is that person feels comfortable to do it again. So I don't know the best way to really handle that, right? Like, maybe I should have called that person out and said something more, right? That's the difficult part of owning a business and providing customer service. Because you're like, well, this is my patient, but how do I really respond?
That is take the business out of it. The fact that you thought that was appropriate, like a politically correct comment, is asinine to me. No matter what the setting is, you don't say that. Would you have said that to your black daughter or your black child? And what would your black child would have thought? Like, I would have been mortified.
But that attitude, those constructs are being taught within the home. So I wouldn't be surprised if those things were said. You know what I mean? Because it's just, it's a mindset. But, you continue to operate with love and move forward and just know that, hey, man, like, some people are just, you're not going to change everyone. I say it all the time, man. I'm just going to pray for them, because I can't fight every single battle when it comes to stuff like that. But I do inform my staff. I let my staff know, like, hey, guys, like, this is how this person is. And the crazy thing is, like, prior to it, I kind of warned the staff and said, like, man, because we see people all day. I'm like, something just tells me, right, like, this person has that inappropriate side to them. So I gave the staff a heads up prior. And so then telling them after, like, hey, this is what was said, just so that they know, just in case there's something inappropriate said or that person approaches them in a manner that's not appropriate, they can be aware. No one was surprised, but I think in my situation, I'm really trying to learn how to not respond in a negative manner because I feel that's the ultimate setup. Right? The ultimate setup is to put me in a position where then I do become irate or I do take on something like that with the label or something like that. And I don't want any parts of that. All right, most comfortable shoe to wear in surgery.
My Danskos. I wear Danskos. You don't wear Danskos.
I used to wear Danskos. I think
It makes you too tall. I don't think you like how tall it makes you.
I don't mind. Well,
Makes
it's
you like
hard.
6'5".
Yeah, it's challenging because when we're the OR to
your
get.
scrubs are short.
Well, and then people are looking at my feet and wondering
Well,
does it
you
correlate
have
with
this
the body part.
problem
It's just awkward.
because you wear the scrubs, the different size scrubs. So like sometimes they're too small. So then they're too small and they're too short. Well, they're also too small in other areas. But for whatever reason, you wear them that size. And then
That's
the
the
other
size
ones,
that's the
then
size
other
that
ones are
fits
too
my
baggy.
body. Yeah, like
If you get the ones that are the length of your legs, then they're super, super, super baggy. But the tight ones are funny.
Are you hating on my surgery scrubs? Like, I think
I'm
they
just
make.
saying you get moose knuckle. That's all.
Oh my god! I think that they make. I'm not the only one. I think that they make. I think that. I think that they make scrubs for a certain type of person. Scrubs
Someone
are.
with no body.
Hey, that's
box.
why. Hey, that's why you need to go ahead and go buy you some Fabletics scrubs.
Yeah, but we can't do We can't wear our Fabletics scrubs on the
Shout
OR.
out Fabletics. No, you can't. You can't wear them in the OR.
Funny.
But that is very funny. No,
You
I
wear
like,
your tennis shoes, but
I
then
work my
you wear
tennis.
the big, huge leg covers because you don't want your shoes to get gross, which makes sense. But
Yeah, my most comfortable shoes I've been rocking have been the New Balance
What's on your shoe?
960s. I have something on my shoe. Oh, it's
Toilet
a piece of hair or something. But I've really
that
enjoyed
is
the
a
shoes.
funny thing to teach our kids. So you obviously don't do it because you don't take the kids to the bathroom very much, probably. And you may, but do you talk to them about checking their
I don't take the kids
shoes?
to the bathroom very much. Like, what are you talking about? Now that they're older, you take them to the bathroom, but the kids go to the bathroom with me. They prefer not to go in
How
because
often?
it's a male restroom.
How often?
Our children are 4 and 6 now, and so they go into the women's restroom. But if we're somewhere,
Okay.
I would take them.
Yeah, but you don't for that reason.
Yeah.
Do you teach them to check the bottom of their shoes for toilet paper?
I have not thrown that out at them.
You should,
I think that is appropriate.
to make sure that the toilet seat cover is not stuck to their butt and there's no toilet paper on their shoes.
I definitely
It's mortifying.
No, I definitely make sure the toilet paper seat is not stuck to their butt. I do. I'm like, I'm not having you walk out of here with no way, Jose.
Yeah, man. It's these things that I didn't think about.
And you have kids and you're like, man.
Yeah, I mean, you can't do it. They got to know to check their shoes.
Yeah, man. So school's obviously started for a lot of people, and
It's tiring.
it's very, very tiring. But it's been an awesome experience. One of the biggest challenges, I think has just been, my daughter asked me the other day, like, why do we have to do homework? Like, it wasn't registering to her, and you had to explain to her, like,
Well, I said, well, why do we practice for soccer? Like, we have to practice for soccer. And she's like, well, that makes sense. And I said, well, I mean, I did homework for 30 years and now I run a business and do homework every single day.
yeah.
So you never stop doing homework.
But there's schools now where, like, our school that we send our children to feel very blessed. Some people homeschool, some people go to private, some people go to public. I mean, whichever you choose to go to and you think is best for your child, I'm all with that. But I found it interesting that public schools are starting at 9:20. I was like,
It's late. I mean, we're early
That's
risers, but some
late.
people like to sleep in. I just,
9:20.
it's hard
What
with
time are these
work.
kids getting out of school? 5:30?
Well, and who works? Like, what are the parents doing? That's hard with transportation.
That's
And
really, really
you can't start your
challenging.
workday until 9. That's hard. I mean, I
No.
want to be able to get home, but the normal day is 9 to 5. I mean, like, we grew up with parents working from 9 to 5 and then it went to 8 to 4 and but people don't like to work early. I don't know. But it's
I
hard.
think the first comment was correct. People don't like to work a lot of
And then
times,
just
but
pause and end period.
And end
People don't
period.
like to work,
Yeah.
period.
It's
I mean,
really
I felt that
tragic.
this week. It's been hard.
It has been hard. I mean, it's a challenging time in that regard. But back to the kids and going to school. Now that the kids are active, they're playing soccer, they're jumping around. What we see a lot of times that comes into our clinic, we'll see kids that come in with heel pain. It's a very common condition that we see with young kids. they're still growing and they have open growth plates.
Mm-hmm.
And so the tendon from their calf muscle that connects to the heel bone, the Achilles tendon, can pull on their growth plate and cause inflammation. And the kids will get a disease called Sever's disease or calcaneoapophysitis. It's something that they typically will grow out of as those growth plates close. But we do see it quite often, and it'll limit the child's ability to go and do activities.
Well, sometimes,
or play
we have to take them out.
sports. Sometimes we have to take them out. So for your parent, all those parents out there, make sure that you're getting your kids supportive shoe
Yeah.
gear.
Oh my gosh.
I
And
think
it's
that's
hard to
super
find
important.
shoes that are for kids.
That are supportive.
We just did that. We bought tennis shoes for the girls, and then
Well, because a lot of these kids
our daughter
wanna
tried
run-
them on without socks, and then with socks they're too tight, and she already doesn't like socks. So
She's not
wonder
wearing
where
them.
she came
Got it
got
from
that
me,
from.
100%.
But REI has good. The girls have been wearing on clouds.
They've been wearing On Clouds.
Those are good shoes.
It's
It's
they're
hard.
decent. They're
yeah,
not.
but it's hard when when they have really small feet. There's just not great shoes, really.
There's not.
I mean,
great
there's a few
options.
brands, but
There's not great supportive shoe options, right? And the kids are at the age where they would love to wear Crocs. Where it's like, okay, like Crocs.
but they
is
have
not
to
a
have
super
tennis
supportive
shoes. Like
but
for
have to have
PE,
tennis
they
shoes.
have to have tennis shoes, which is hard to find. And depending on your price point, I mean, it's just it's just not easy to get support
But because
shoes.
of that, right, your child can have foot pain, right? So
Yeah,
not only
right.
the heel pain, a lot of kids are what we call overpronated or have flat feet. That's also something that sometimes
I'm
they
seeing
can
a lot
grow
of
out
kids with high arches.
Oh yeah.
My second cousin just texted me about her kid having extremely high arches. And so everyone assumes flat feet. And
Yeah.
I have more patients than not have high arches. And this is not something that just came in adulthood. It's their whole life. And so not being aware of what their foot condition as a young child, if people knew earlier on, then it would help save them, I think, down the road. But it's not the thing that people know about. Podiatry is still very much a profession that a lot of people don't know about as like the go-to thing, or the primary care wants to manage it themselves.
But it's like being like, well, what's the best toothpaste or what, right? The first thing people are going to do is what's the best shoe for kids? They're going to Google it, right? And so, yeah, it's just something you don't know what you don't.
And there's different shoe companies every year. I mean,
Right.
when we first started doing this, the different shoe brands, there's different shoe brands now. Like Hoka is a huge shoe brand that I recommend on a daily basis for the comfort, but they don't make kids shoes.
They don't, yeah.
I was surprised to see on Cloud.
Hoka, what's up? Can we get some some supportive shoes for kids?
Yeah, that would be great. I would buy them for sure.
From a branding standpoint, you would think like, man, get these kids engaged in wearing these shoes early. That creates a culture within itself.
Yeah,
you know?
well,
Like,
right. But it's hard because they grow.
He's calling me. Mic check 1 2 1 2. Dr. Pinheiro, what's up?
What in the hell are you doing?
Listen, man.
You're on record.
Hey, I got you on the podcast, and I was like, I gotta call my brother-in-law, man, because we're talking about teeth, and we already got some things wrong, so we got to make sure we get them right this time. Hey, man.
Why do you do the podcast at 12:42 in the middle of the day when I have patients?
That's exactly what I said. He's either in surgery, doing something, doing an implant. He's got patients. I said, but he'll call me back because I'll leave a message. Hey, man. So here's my thing. We look at feet all day, and we were talking about how there's certain smells that we deal with from feet. Like honest to God, this is a real question. When you go into someone's mouth and it smells bad, like, do you think there's a direct correlation between how their mouth smells and the rest of their body odor?
You could say that for some patients, yeah. But a lot of patients are, for some reason, put very little priority in the parts of the body that you can't see or smell. So
Yeah.
feet can be covered up.
Yeah.
Mouth can be, a lot of mints and a lot of perfume.
Right.
But they're not smiling big. Their lips are always together. They're
Yeah.
covering their teeth with their hands. So they're aware of it, but they're either deathly afraid of dentists
Yeah.
or of procedures, or they're just not concerned about going to see somebody to take care of it.
Yeah. No, that's a great point. When you meet a patient like that, Dr. Pinheiro, how do you help them kind of overcome some of those insecurities? I mean, you're a prosthodontist, right? So you help essentially reconfigure people's mouths and make them beautiful. But there's that beginning stage where, I mean, you come in to see you and you do have your mouth over your hand over your mouth because you don't want someone to see. Like, how do you make your patients comfortable enough?
I don't know if you guys run into that, or people like, man, I wish I could wear flip flops, but my feet are funky.
Yes.
And I don't want to wear. And can you do some, bunion surgery on
Right.
my feet? So that, I mean, it's the same thing, right?
Yeah.
So, except, it's easy to wear sneakers instead of flip flops or covered shoes.
Right.
Your mouth, your smile is one of the first things people notice on people when they first meet you. So what was interesting was during the pandemic, people would wear a mask and be happy.
Yeah.
And they were able to be part of a conversation and laugh and be themselves. And as soon as the mask comes off, they're back in the corner because they don't want people to look at them when they're talking because their teeth show.
That's so true, man. That's so true. But I mean, the beauty of having professions like mine or yours is that you're able to truly transform somebody's life, and there's so much power in that, and I don't think people understand how much pressure comes along with that. I mean,
well, but the other thing is we're not trained for it.
Yes.
You didn't get that. You weren't trained in your training. Hey, you're going to have a huge impact on people's life. And this is their emotional state when they're coming to see you. Nobody talks about that in dental school.
It's true.
Nobody talks about these things. Even for plastic surgery training, they just tell them, this is how you do the procedure to the best of your ability.
Right.
There's no training on the emotions that patients carry because they're insecure about their body, because they're insecure about their teeth, their feet. So I wish that the training programs would include that in their curriculum because you guys weren't taught that either.
No.
I'm sure of it.
We were just talking about that, man. We were talking about the psychology, right?
Yeah.
Like how we could have dove into that so much more in our training, like you're saying, Dr. Pinheiro, because it is, man. Like, how do you help somebody that's been going through something like that, that's been so traumatic for them? I mean, I'm sure even when you fix the people's teeth, or I fix their feet for the first, few months, even maybe a year, they may still be covering their mouth because they're so used to it. Like, they're just like, oh crap, now I can actually smile, or oh wow, now I can actually wear flip flops. I mean, I had a guy
it's their muscles. They don't even remember how to smile.
Right.
Oh, yeah.
They can't use their muscles to smile. They've been hiding it for years. And then it's like, smile. Like, I don't know how to smile.
We have to go.
It's like, okay, well, you got to go in the mirror and start practicing and work those muscles again so you can do it again.
Wow,
because,
man.
It breaks my heart.
Dude, I love that, man. How life-changing, dude. I mean, I know I called on something, funny, but I think it's so great for people to just hear the impacts that we have on totally different spectrums of the body, right? You dealing with the mouth, us dealing with feet. I know a lot of times we get asked like, well, why feet? Or you get asked, like, why'd you go into dentistry? Why people's mouths? But it is something that you don't know what you don't know. And they are two of the most, I think, forgotten body parts, right? Like, seriously, like you said, because you can hide them. It's a little bit harder with your smile. And I get it too, like having dental procedures or even having foot surgeries, like these things can be expensive and costly, right? Like the big thing for my patients is they're like, I can't be off my feet for 6 to 8 weeks.
People can't afford shoes.
Right.
Like people, dentistry is, a lot of insurances don't cover dental stuff, but then like for feet, the insurance may cover the clinic or the appointments to come see a doctor, but like our recommendation is getting better shoes, and people can't afford that.
Yeah, it's true.
So it's so limiting based off of the financial standpoint of it, is that their foot health, their teeth health, like all of that is so dependent on a financial basis that it makes it really challenging.
No, I agree with you. I totally agree. Well, Doc, I know you're busy. I didn't want to take up too much of your time, man.
Guys.
But I love that you came on and gave us a call back. We'll have to get you back on soon, man. We love you. Give my nieces my love, our love.
Yes, I will. You too.
And then we'll talk to you soon.
All right, buddy.
All right, man.
Talk to you later.
Bye.
Okay, bye-bye.
That's my brother-in-law, man. Very humble dude. I mean, he's essentially a world-renowned prosthodontist and has really had such an impact on people's life. It's really cool to be able to talk to him just about medicine in general. Obviously, like I said, we're on different spectrums of the body, but
he does
a lot of things.
great things with like 3D printing, and
Yeah.
he understands that that's part of our passion, and so it's fun to share those aspects of medicine with him because he's innovative. I mean, he's created his own instrument and things like that. So it's really neat.
I mean, I think at the end of the day, the biggest thing I want people to take away is like, we all have our own insecurities.
Yeah.
Right?
We do.
Like we do. I mean, there's things that don't ever judge a book by its cover. Just because someone looks healthy doesn't mean that they're healthy mentally,
Yeah, right,
spiritually,
exactly.
emotionally. And
Yeah.
so just continue to give each other grace, continue to spread love. I'm Dr. Jeremy Cross,
And I'm Dr. Allie Cross.
and this is Footprints to Blueprints.
Have a good day.
Gonna make the world a better place. Gonna make it home.